Today we are talking about an eye condition where your vision becomes blurry and for some it eventually leads to vision loss. UofL Health's Dr. Aditya Verma is here to tell us more about age-related macular degeneration. So doctor, let's start with the diagnosis. What exactly is this?
See, we're going to call it AMD, and this is nothing but the aging of retina. This is usually seen in patients who are 50 years or beyond, but more important, this is a very important cause. This is leading cause of blindness in patients who are 65 or older in the US.
Okay, so when we're talking about some of the signs and symptoms, what should people be looking for?
Early in the form of the disease, there's no problem with the vision. It can be detected only on a routine examination, but the late forms of the disease can present in two different ways. One, it can present as bleeding in the retina and the patients have a sudden drop in the central vision, or two, it can present as a slowly progressive loss of vision, a profound loss of vision over a period of months to years because of the death of cells of retina.
And what age group would you say is seeing this most prevalently?
It starts beyond about 50, but as the age progresses, this disease is an age-related process.
And we know, especially with the dry AMD, some folks might not even know it's happening until it's too late. So
Exactly.
what are some of the best ways to prevent it or possibly even catch it early?
I'm going to highlight 4 different points here. Point number 1, this is an age-related process, so there's no treatment which can stop or revert the process. Point number 2, a little change in the lifestyle modifications, increasing more of green leafy vegetables, increasing seafood, increasing fish oils in the diet, avoiding smoking and avoiding sunlight exposure, having a good control of obesity and blood pressure, and the most important, getting your AREDS2 multivitamin formulations regularly. It slows down the progress a lot. Point number 3, if the patients have bleeding, they need to start the injections as early as possible to at least gain a little bit of vision. And point number 4, and most important, when you're 50 years or beyond, you must have an eye examination at least once in a year with a retina specialist.
That eye examination, that could be the time where it's actually caught.
Exactly.
And is that with an expert you want to be seeing?
A retina specialist, I would say.
Okay, excellent. Thank you so much for this great heads up. You guys can always learn more by checking out UofL's websites, and we appreciate you coming in today and filling us in on this one.
Thank you so much. My pleasure.
Thank you, doctor.